One of my deepest core values is health, both physical and mental. And it took becoming a nurse in the middle of a global pandemic to understand just how essential that value is and how fiercely I need to protect it. I graduated from nursing school in 2020, and like so many others, I stepped into the profession believing I could make a difference. I imagined compassion, teamwork, and the feeling of helping people heal. What I walked into instead was a COVID intensive care unit at the height of uncertainty, a place where exhaustion hung in the air as heavily as fear. Every day, I watched patients fight for breath. I watched families say goodbye over FaceTime. And I watched my colleagues, nurses, physicians, and respiratory therapists, carry impossible loads with almost no acknowledgement or support. What I didn't expect was how quickly the system around us would unravel. Science was suddenly political. Resources were scarce. Nurses became both the lifeline and the shield, but rarely the priority. As a new nurse, I convinced myself that sacrificing my physical and mental health was part of the job. I skipped meals. I stayed late. But the hardest part wasn't the work, it was the grief. The kind of layered grief that comes from witnessing endless death, feeling helpless, and then being expected to show up the next day and pretend everything was normal. I realized that no amount of passion or dedication could compensate for a system that wasn't built to protect the people working in it. And for the first time, I started asking myself, what happens to my patients if I'm not well? And more importantly, what happens to me? That was the moment my core value of health shifted from an abstract idea into a personal non-negotiable. I began to understand that caring for others means nothing if I'm not caring for myself. I learned that physical health isn't just vital signs on a screen. It's sleep, nourishment, movement, and rest. Mental health is everything that keeps you resilient. Boundaries, therapy, community, and purpose. Leaving the COVID intensive care unit was one of the hardest decisions I've ever made. Not because I was giving up after 2 years of work, but because I was choosing myself, maybe for the first time. I had to unlearn the idea that self-sacrifice equals strength. I had to redefine strength as knowing when something is harming you and having the courage to walk away. Today, my core value of health guides every part of my life. How I work, how I show up for others, and how I protect my energy. I'm a better nurse, a better fiance, and a better human because I learned painfully and honestly that my health is the foundation of everything I want to give in this world. This is the story of how I came to hold health, both physical and mental, as one of my most essential values.